Hi everybody, I'm Erin Perez and I'm here with Dr. Regan for another interview. And tonight we're going to be talking about the DSM changing from 1952 to 1980 and taking away the stigma of being defined as gay and lesbian. Dr. Regan, can you please share with us how it changed from 1952 to 1980, and what was the significance of this change for both the world of psychology and for gay and lesbian clients?
Well, thanks, Erin. It's the word significant just popped out at me, and how tremendously significant it was when you think about mental illness, the designation of being diagnosed as mentally ill. Before these changes, that was the case. And as anyone can imagine, gay or lesbian people were afraid of acknowledging their genuine feelings for fear of being judged and labeled, diagnosed mentally ill. Very significant change.
Now, this significant change, what did it take to bring it about? Was there a lot of effort required in order to bring about this change?
Yeah, that's interesting. I think it was in 1952. There was an annual conference of the American Psychological Association, and a number of activists had been planning on confronting the American Psychological Association, the American Psychiatric Association, about this. And it was a little revolution. It was an absolute protest. They burst into the meeting and said, we need to be heard. You know, we want to tell you, what we think about this. And it became a very, very amazing change, a historical moment in the history of the American Psychological Association and the movement of the LGBTQ community.
I wonder if it talks about that in the documentary Cured, which I'm finding is difficult to watch. You need to actually schedule a screening on the website. Do you think it's worth it to watch this documentary, and if so, why?
Well, if you're interested in this story, it would be interesting. There's other articles online documenting what happened at that meeting of the American Psychological Association, and of course, I think just in general how tremendously it affected the world of psychology and the movement.
Last question. Have you had gay and lesbian clients, and if so, how do you think this change has helped them and helped you to help them?
I have had many gay and lesbian patients, and the stigma still exists to some extent. And a lot of it has to do with the age of the patient now. And of course, so much of the influence was their parents, coming out into their families and their parents. And that was very difficult, and still is. You just can't help. Generations pass messages on. Great-grandmother, great-grandfather, grandfather, and father. So it's really fading, depending on where you are, but there's also still some stigma, and some people are still cautious. I happen to know that there are some corporations that aren't actually that friendly, so people have to be careful about coming out to their employers. Shouldn't be that way, but it's just the reality of life. But it's a big, big, big change.
So, sounds like progress, not perfection.
it's progress and getting better. And yeah, we'll just see one day at a time how it grows. And of course, it's up to all of us to be careful not to be judgmental or you know, get caught up into the old stigma, which was absolutely incorrect, inaccurate, false judgment. So it's really great that we today know that finally the psychology field and psychiatry field, you know, they've done the best that they could, and we continue to monitor that. So there's, you know, equality.
Mm-hmm. Well, thank you so much for joining us this evening. And if you would like to comment on what we discussed tonight, please go to www.drchrisregan.com, and we'd love to hear from you and have an open dialogue. And please schedule your 20-minute free consultation as well. Thank you so much, and can't wait to hear from you.
Thanks, everybody. Bye-bye.